That was Clark County Sheriff Joseph Lombardo talking about the, quote, disturbed and dangerous shooter behind Sunday's massacre at a Las Vegas country music festival, in his own words. As you heard from the sheriff, investigators are having a tough time figuring a motive for the deadliest mass shooting in modern U.S. history, and that's because officials say the shooter, Stephen Paddock, showed no signs or indications that he was capable of such a horrifying act. Police know he methodically planned to inflict as much harm as possible. They have tracked down his dozens of gun purchases. They've tried to piece together his movements before the attack, but what remains a mystery is the simple question, why? Paddock's brother, girlfriend, and neighbors all say they never suspected a thing. It appears so far that Paddock's past and temperament differ from other mass shooters or serial killers. To talk more about that, I'd like to welcome Dr. Ziv Cohen, Clinical Assistant Professor of Psychiatry at the Weill Cornell Medical College. How is it different from other killers, other people engaged in mass shootings? Is there usually a clue of some kind or some sort of attribute?
Well, these individuals, in past studies, they have been shown that usually there's some kind of leak. So some kind of a note or a letter or something on social media that says something very significant is about to happen, even if the exact intention is not revealed. It's possible that there was such a leak in that case, and there are many people who are being interviewed, so we may discover that. But another major area in which he differs from mass shooters is his age. Mass shooters are usually young men, so at his age, in his 60s, that puts him outside the group.
And to keep it so secret from his girlfriend, from his family, a lot of people had no idea he was collecting these guns, and then to be so meticulous and organized in how he planned it.
Well, many people are not quite what they appear to be and have secrets or secret lives. I think that when you're thinking about an individual like this, and I can't diagnose him specifically, but he had 2 first-degree relatives who had significant criminal justice involvement, and that's highly significant. He also had a significant behavioral addiction, one that we know about, which was his gambling. There was some report that he had controlled substances that were prescribed to him, and he was an extremely private person, which might suggest paranoia. So there are clues in his profile that I think investigators will likely be following up on.
Everyone likes to talk in these investigations about a trigger point, but is it possible that it wasn't one trigger point, but maybe a cumulative effect of several events that led him to do this?
I think that's highly likely. I think from the reports that have surfaced and what we just heard from the police, that for years there was a pattern of behavior that may have not been known to people around him. And so one certainly wonders, if someone with his profile is someone that we might not think would age very successfully, a string of broken relationships, behavioral addictions, and so you might consider that over time there would be accumulated emotional injuries, narcissistic injuries that might lead to this kind of behavior.
So interesting, Dr. Ziv Cohen. Thanks so much for joining us. He's Assistant Professor of Psychiatry at the Weill Cornell Medical College. Thanks again. We appreciate it.
Thank you.
Carolina Panthers quarterback Cam Newton is catching some serious heat for an insult he threw at a female reporter. The superstar quarterback was once described as being